Are psychiatric wards dangerous? Well, I think it would be misleading to say they're never dangerous, but they certainly aren't like that all the time. You do get some patients that are agitated because of their symptoms at some times. But I would say that the staff and the protocols are designed to deal with it. So staff are trained in control and restraint. Doctors can prescribe extra sedation or extra sedatives if necessary. Some wards have seclusion rooms to take people. It's like a locked room if they're extremely agitated. In terms of the members of staff, all wards have nurses on the ward 24/7. There is a consultant psychiatrist, such as myself, who's in charge of the patient's care. Usually there's a junior psychiatrist who does the more day-to-day kind of activities, who's on the ward on a more regular basis. Hospitals or wards should have occupational therapists, psychologists, and social workers. So occupational therapists help deal with activities, whether it's setting up education sessions, helping the patients find voluntary work, or engaging in sports or going to the gym. Psychologists do talking therapies. That could be one-to-one sessions, could be group therapy, typically once a week. There's a whole range of different types of psychological therapy, from drug and alcohol rehab to relapse prevention. Social workers tend to deal with things like benefits for the patients or contacting their family. I say those members of staff should be there because I've certainly worked in poorly resourced wards where there just isn't those members of staff. There's only the skeleton nurses and doctors. So a typical psychiatric ward has lots of patient bedrooms. The ward itself tends to be locked, but the bedrooms aren't, so the patients can come and go as they please within the ward. There's usually like a big patient lounge with a TV, there might be a pool table, might be a games room. Typically a psychiatric unit will have like a shared gym, or there'd be like a cafe. And no, there is no pool, there is no bar, there is no jacuzzi, so don't ask. Good wards have staff that are full of energy, have some resources. The staff are present on the ward and they help the patient engage in activities to pass the time. Bad wards have none of those things. Personally, I've definitely worked in both types. So medication is obviously an important part of the average patient's rehabilitation journey. Patients can be medicated against their will if they're detained under the Mental Health Act. That's only done as a last resort, and it's not a pleasant process or experience for anybody involved. It basically involves physically restraining the patient and then nursing staff giving injections which contain antipsychotic medication usually. So voluntary patients can come and go as they please. As the ward is physically locked, they might have to ask a nurse to unlock the door. And section patients need to be granted leave by their psychiatrist, by their consultant. That usually happens once the consultant sees that the patient is settled, that they've not got acute symptoms, that they're not a risk to themselves or other people. Generally, leave starts off as escorted, so the patient has leave with one or two members of nursing staff. If that goes well, then they have unescorted leave. So I'm going to answer the ultimate question, which is this: what is it like for the patient? What's the overall experience like? Well, I have to say that it's very variable. It's kind of like asking the question, what is school like? So some people would have hated school. They would have struggled academically. They'd have been bullied. Some people would enjoy school. They'd have made decent friends for life. Similarly, the experience of being on a psychiatric ward is variable. Some people find it a supportive and therapeutic environment and like a break from their life when they were at their lowest ebb, when they were at the edge of a breakdown. Some people just hate the experience, so they don't like being locked up, they don't like being around other disturbed people. If I'm being brutally honest, from the patients that I've talked to, more have a negative experience than a positive experience. And that's actually illustrated really well in my earlier interviews. So I interviewed a man called Osama, one of my very first videos, who's actually a medical student. He was detained. He thought that his admission was a lifesaver. I've interviewed a couple of other people, Lucy, a journalist, and also Ariel, a podcast host, who didn't have such good experience of psychiatric services. But I think it's important to put the context into consideration. So if you ask the average person if they enjoyed their ambulance ride, probably a lot of people would say no, because they were in pain or they had broken bones at that time. Doesn't mean there was anything wrong with the way the ambulance was driving. When we see people, they're in crisis, they're close to breakdown. Sometimes they have no insight, sometimes they're medicated against their own consent. However, despite all of this, I'm convinced that some psychiatric admissions save lives. I've literally seen this. I've seen people that have come in who are close to suicide, get some support, get some treatment, get some therapy, just have a feeling that they're being listened to and cared for, and they leave in a much better situation. Similarly, I've seen people that have come in, are floridly psychotic, get some medication, get some therapy, and leave in a much better condition than when they came in. Hello, cruel world. What you just saw there was a tiny little tantalizing taste, kind of nutty, of a much longer episode. You should go check it out if you're interested. The link will be in the description below. If you're a fan of either true crime or mental illness, or the crossover between the two, then you've got to go and check out my main YouTube channel, A Psych for Sore Minds. My name is Dr. Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. My channel covers a whole range, a smorgasbord of topics related to true crime and mental illness. For example, high-profile true crime cases with my own kind of personal psychoanalysis of individuals. I discuss issues related to criminality. I discuss individual diagnoses. I give advice about psychiatric problems. I interview ex-patients. I do a lot. There is something for everybody on my channel, and I implore you to go and check it out. You can even steal some of my ideas, palm them off as your own to impress your friends and impress people at dinner parties. It's all good. I've got you back. Until next time, stay euthymic, check out my channel, and please do not forget, I love you.